is no one silver bullet for pain. A bunch of different studies have different numbers, so I'm going to throw a lot out there, but in general, the second day you're home is where your pain is going to be the highest, and it's probably going to be between 4 and 5 out of 10 when you're sitting still, and about 6 out of 10 to 8 out of 10 when you're trying to sit up or move. So that's pretty expected. The good thing is that most people quit using their opioids by about 3 days afterwards. Most people's pain is down to a 2 out of 10 when they're sitting, a 2 to 3 out of 10 when they're not moving. There have been studies looking at exercise afterwards, and again, the good thing is that doing an exercise rehabilitation program absolutely makes you get better faster. So make sure your hospital offers an exercise rehabilitation program. One other nice thing is that there doesn't seem to be a difference whether or not this exercise physical therapy program is hospital-based or office-based or done at home. So there are a lot of telehealth options now where you can learn the exercises you need to do with a therapist for a 30-minute to an hour session, and then it seems to be just as good if you then repeat them at home, and that'll help you get better faster. One thing that's interesting is that the brain actually compensates to chronic pain. So they did one study that looked at the thalamus of people who'd had chronic knee arthritis or needed to have a knee replacement, and their thalamus was actually a lot bigger in their brain before surgery. And 6 months after surgery, it was back down to normal. So I'm not saying it's going to take 6 months, but at least you will get back to the place where you don't have chronic pain. And that brings me to one other part. So being worried about, am I ever going to be normal again, is something that can make your outcomes worse. So 5 to 20% of people do have chronic pain after knee surgery. And the risk factors for this are when you're on opioids beforehand and when you don't exercise or have an active lifestyle. But the third thing is something called catastrophizing. If you're really worried that you're never going to be the same again, that this is going to change your life forever, that you're going to have the surgery but you don't think it's going to work, you probably want to try to work with someone beforehand to help you manage those feelings. Meditation, even just deep diaphragmatic breathing twice a day for 10 minutes, those things can help readjust your parasympathetic system, and that's important because the sympathetic system is the fight or flight. That's the, oh my God, it's never going to get better. And that's what happens with catastrophizing, is that if you think, I am not going to be able to manage my pain, I don't think I'm going to be able to do anything to help my pain, I am going to be one of those in the 5% who continue to have pain. If you go into the surgery with those beliefs, it makes it a lot harder to cope afterwards. So there's actually a catastrophizing scale, and it's very correlated with having worse outcomes afterwards. So you may want to look it up and try to see if you are somebody who's likely to catastrophize, and do what you can do to learn how to meditate or change those attitudes beforehand. I mean, some people have to lose weight before a surgery, and calming those attitudes down before a surgery will be really helpful.